Today, I have with me Dr. Mike Sonick, author of Treating People, Not Patients. He's a passionate voice in medicine, promoting empathy and individualized care, and brings a wealth of experience and insight into humanizing the healthcare experience. Not only does he does that, he's one of my great friends. And welcome, Mike. Thanks for joining us today.
Andre, thank you for having me on the program. I'm happy to be here.
Today, I want to discuss with you is your book. Just the title alone, Treating People, Not Patients, spoke volumes to me. So maybe before we get too far in this, can you just give us a quick background? You're a DMD, and I'm not too sure what that means.
You know, I'm a doctor of medical dentistry, which is a dentist, and with a medical background. I'm also a specialist in periodontics, which is the study and the treatment of diseases of the gums, the bones, and involves bone and gum reconstruction, dental implants, and treating infections of the oral cavity. So that's my background in medicine and dentistry. So I've been a practicing dentist since 1979, so I have a long time in the field. And my passion has always been, hospitality and healthcare. So that comes back from, a lot of times I spent in the hospitality industry.
Hospitality and healthcare. That seems like an oxymoron in the medical world, because that's the thing that when you're talking to me about your book and that one workshop there, it very seemed counterintuitive to the healthcare professional world, caring about people.
Well, it's actually not counterintuitive, but it's thought to be counterintuitive.
Interesting spin.
Yeah, because people feel better when they're treated well. There's actually data for that people who are under less stress heal better, people that are treated better and have a better understanding of their outcome and what we're going to be doing for the patients. They have a better, first of all, their acceptance rate is higher, their compliance is higher, and their outcome is better. So there's so much data that decreasing stress improves outcomes, both emotionally and physically. So this is something that I have been thinking about, my whole career. A lot of it I did unconsciously. So I have a neuro-linguistic programming coach, which is the study of how people relate to each other and they speak and they look at each other. I'm sure you know about that. And one of my coaches said to me, he goes, that I'm unconsciously competent. This was before I wrote the book. He spent some time and I think Stephen Covey talks about that too. And when I was talking to patients, he would just watch me. He says, man, you do this very easily, but you're not even sure what you're doing. You just get good outcomes. And because I had been doing it a certain way, I really reacted to my patients based upon how they reacted to me, and I figured out the type of behavior. But I didn't know how to teach it. And so over the course of the last few years, and when I was writing the book and before I wrote the book, I started to incorporate some of the skills that I've used in talking to patients into my lectures. Now, most people, when they see me in a lecture, they want to learn about what I do, how to treat infections, how to do bone grafting, et cetera, how to place implants, which I find interesting. And, I'm good at that. I'm doing it for years. And I spent, thousands and thousands, hundreds of thousands of hours doing this career, which I enjoy. But in dental school and medical school, what they teach us is how to do procedures. They teach us how to treat a gallbladder, how to treat an infection, how to prescribe antibiotics. And if that antibiotic doesn't work, you try this antibiotic. They never really talk to you about treating the human being that sits in the chair. I once went to a lecture and one of the dentists said, I looked out at my patient as I was working on his teeth and I realized that there was a body attached to his head. That's, he said as a joke. But that's the way a lot of dentists and physicians think.
And a lot of professionals do that too. Engineering, accounting, any professional field seems to see that too. People as numbers, not as people.
Right. And I'm talking about treating people, not patients, but it could be, treating customers. It could be, it could be treating people, not customers. It could be treating people, not anything. Any field, whether, as you said, engineering, sales, it could be gardening. It could be someone's painting a picture for you. The restaurants, the hotels, they're really based upon your experiences. So when people go to, say, like a great hotel is the Four Seasons Hotel or the Ritz-Carlton, they'll stay in a room. Some people can afford to spend $20,000 a night to stay in a hotel. Why would somebody spend $20,000 a night? Is the bed better than the one they have at home? You're spending $20,000 a night. Are you going to get better food there than you'll have at home or better music from the stereo? No, you're not going to. But the experience in that room is going to be different than what you get at home. And what people really want, of course, people want to be treated well. They want to have good care. They want to make sure that you take out the right tooth and treat the right infection, use the right antibiotic. But they really want to have a very meaningful, positive experience with the person that they're dealing with. And that's where it all starts. And it's really simple. You just have to be nice to people. And really, that sums up my book. Be nice to people. So here's 4 words. If you're nice to people, they're usually nice back. You know, like last night, I was in my office and I stayed late. I work 2 days a week and I'm booked 4 months in advance. So there's no time in my schedule. So if somebody wants to see me, the only time I can do, I got to come in at 6:30 in the morning or I got to stay at 6 o'clock at night.
Right.
And so I had a guy that was in yesterday and he's very successful. He owns the most successful outdoor arena in the United States. And he is, you know, he's got some gravitas to him, and I don't know him that well, but I treated him a few weeks ago, and I give every patient my home number, my cell number. So he called me on my cell, and I treated him. He had a really positive experience. He went back to my team, to the person that referred to me, because I love this guy. He's very, great. Then he had another abscess, and so I said, well, I don't have time. I'll see you at 6 o'clock. So I sat him down. I got him numb, and I said, I'll be back in 15 minutes. Well, I had 9 postoperative patients, and that usually takes about 30 minutes. But out of those 9 patients, 4 of them wanted 20 minutes of time. And it was like everybody wanted more time. So when I came back into the room, it was an hour, not 15 minutes. Now it's at 7 o'clock at night. And this was a guy that I thought I had a good relationship with and could understand what I did for him by getting him in, because it would have been 4 months. He goes, that's the longest 15 minutes I've ever had in my life. Now here I'm staying for him, and he wasn't treating me very nice. And I did something wrong. I said, how could you say that to me right before I'm about to use a scalpel and give you an injection? I said, you must have a lot of confidence, but I'm not going to take that personally. And then he turned to me and he says, well, I could leave. Now this guy's worth a few $100 million, but so this guy's not used to anybody talking back to them. And I realized right then I should not have joked like that with him. I should have immediately apologized, even though I've been working at this point. I got in the office at 6:30. I'm on 12 and a half hours of working without a break, and I shouldn't have done that. So now I had to backpedal, and I took out the tooth and I took care of him. And we ended up spending another 20 minutes just talking about, him. That's what he wanted to talk about and how great he was and how many projects he had. And I found out he's worth a few $100 million, which I didn't know, but he wanted to tell me how great. And so right then in that moment, I had made a mistake. I didn't take the extra second just to say, apologize, I'm sorry. I was a little bit glib thinking that he could take it, but I didn't know that. Maybe he had something in his going on in his personal life that wasn't going well. Maybe he had a fight with his wife. He just found out that one of his children had a problem with their kid. I have no idea.
Right.
And that's what's very important for me, to always be present to where that patient is in my office. And when a person comes into my office, or a person walks in to see a divorce lawyer, or they go to meet their accountant at the end of the year and they have told that they have to pay taxes they didn't pay, you're usually seeing people at their worst. And there's a benefit in seeing someone at their worst. Because if you're your best at someone's worst, you give them a bridge, something that they didn't expect. They expected to come in there and get a procedure. What you're giving them is a human being that is coming off of your ivory tower of being a doctor or an engineer or an accountant or a lawyer or whatever you are. And you're saying to them, I'm here for you. How can I help you? And one thing that I always say, and this is important no matter what business you're in, on the first visit, I always say, how can I help you? I usually greet people like that. Not always those words, but I always find a way to say, I'm glad you're here. You are in the right place. And it's important that people know that they're in the right place because they have no idea. I have never met a patient that knows as much as I do about periodontal disease.
Right.
They just, they don't know anything. They're scared. If I came to you for an engineering project, I don't know anything. I don't know anything about engineering, even though my father was an engineer. I don't know much about it. And I have to trust you. And how do I trust you? I can't trust you by vetting you and figuring out, going on Google and checking out your credentials and seeing if you're a good engineer. That doesn't mean anything. I trust you by how you make me feel. And that's what this book is about. It's how we make our patients feel. And most doctors never think about that. They think about closing the case, getting the procedure done, suturing it up, submitting it to insurance, and getting through their day. So oftentimes I'm called upon to do things I don't want to do because it's the right thing to do for the patient. And I can go on with story after story about that.
So Well, you just said a lot of different things, which is counterintuitive to the accepted social norm about this in the professional world, even in the sales world. What you're doing is actually bringing yourself down to the same ground as your patient. What can I do for you? Or how's your day? Like you said, like bring yourself down from the ivory tower, but society is stuck on having this feeling of an ivory tower, of the expert, of the one know-it-all. So you must come to me. Therefore, you are lucky to be with me. So
Yeah.
in the sales world, even in the consulting world, we get a lot of those attitudes. Why do you think that is?
I think it comes from a sense of fear and insecurity because you hide behind the curtain. I
Right.
use a metaphor, the Wizard of Oz. So, I'm sure you've seen the Wizard of Oz, you have Dorothy and Tin Man and the Lion and Scarecrow, and they're all walking and they all want these things from the wizard. And they think the wizard is this all knowing. It's just a guy behind the curtain, with
Yeah.
some sound effects. I actually used that metaphor to patients. I said, I'm going to take you behind the curtain. I'm going to show you that I'm a human being. I just happen to have a skill that you don't have, and that's how to fix your mouth. And I really even make it so, like when I'm going to do a surgical procedure, people are scared. They go, let me show it to you. And I pull out a PowerPoint. I just show them what I do, and they go, because people, no matter what people think, their thoughts are always worse than what's going to happen. And I just show them what I do, and they go, oh, okay, doesn't look so bad. And so I make it very, very, very easy for them to understand it. What I want to do is I want to give patients back a feeling of control so that they can be in control of the decision they make. Even though they really don't know what the right decision is, I educate them. And in Atal Gawande's book, Being Mortal, which he talks about end-of-life experiences, he wrote that book after his father died of cancer. Because his father died of cancer, and his father had a really bad death. His father wasn't a physician. Atal Gawande is a Harvard-trained physician. He's written a lot of books. He's one of the major thought leaders in the United States. And in his book, he talks about 3 different types of doctors. Because even though he's a Harvard-trained doctor, he just became a patient or the son of a patient, even though his father was a doctor. And his father didn't get the care that he probably should have because they turned it over to the doctors. So he talks about 3 types of doctors. Doctor 1 is the one you just talked about. I'm the doctor, you're the patient. I'm the engineer, you're the client. I know best. Listen, do you have a degree in engineering? Where'd you go to medical school? That's an arrogant doctor, which people hate.
Yep.
Now, by the way, people our age, and you're younger than me, but this generation, that doesn't work because everyone's an expert because they go on the internet. Their mentor is Google, and you can find out anything. Matter of fact, 90% of all patients go to Google before they meet the doctor. They want to see the reviews. Most of the reviews aren't about the doctor, they're about the team. So that's the first doctor. I'm the expert, you are not, listen to me. The second one is the way most doctors practice today. Here are your choices. We can do it this way or this way. This way costs $5,000, this way costs $2,000. Your insurance is going to cover this, but you may have to pay this. I can do this for you now. And they give them a bunch of information, and the patient has to make a decision. They go, what do you want to do? And the patient's confused because they can't really make a decision because it's out of their comfort zone, it's out of their experience, and they're ignorant of what the right thing is. And that's the way most doctors practice today. And my practice is really made up of people who've had bad experiences. So people come in having treated by good doctors, but they had the wrong procedures done. They'll say, well, let's get that tooth out. Well, I never take a tooth out unless I have a way to replace it. Because patients don't know that once you lose the tooth behind is going to shift, the one below is going to move up, and then there's going to be a space there, and they don't get it replaced right away. Then it's going to be crooked. Then they have to go to orthodontics. Then they're going to need a bone graft. And then they got to come back, and it's like, a year worth of treatment that could have been avoided if they knew what the consequences would be of that procedure. And they're not always told that. So the way I would recommend doctors practice, and not only just doctors, but any salesperson, it's basically not sales, it's education. Is to educate the patient, educate the client, educate the customer. Whether you're buying a head of lettuce or you're going on a vacation, to Patagonia, how are you going to get there? What are the accommodations like? Learn how much it's going to cost. And give my patient all the information possible in very clear, easy to understand terms so that they can make the best decision for themselves. And I call that a cost-risk-benefit ratio. I will tell the patient the cost, the risk, and benefit. Most people think cost is money, but it's not. If you spend too little money, it's going to cost you more. You know that as an engineer. you don't construct the building properly, you go cheap on the costs, you know, the materials, you don't put the proper footings in, all of a sudden the building collapsed. Now you have a lot of cost. You have multi-million-dollar lawsuits, you know, and I'm sure you feel very, I mean, I'm sure it drives you crazy when you see a building or a bridge fall down. You know, that's they spent millions of dollars on, people lived in for years. Somebody made a mistake there. So I try to get the patient to understand what their options are. And I called my patients my co-therapists. So it's a collaborative decision where the patient gets to see what's going on in their mouth. They get to know the options, you know, the cost versus benefits. And then we go ahead and we go ahead with treatment. But they're told everything before. And I make it very clear that they are in control. They're driving the bus of their treatment. The only time I don't do that is if they have a life-threatening situation, say an abscess on an upper tooth that's close to the vein that goes into the brain. If that doesn't get taken out, they could die. I said, no, this has to be taken out. I never tell patients they have to do something. You often hear when patients have cancer and the life experiences, and a lot of your listeners have had parents or people that have had that. They go, we give you 6 months to live. Does the doctor know how long you will live? I have a friend that was given 3 months to live 10 years ago. You know, I mean, he's healthy. So that's how I do it. I try to give all that information to the patient. It's a good question that you asked. You know, we don't want to talk to them for the mountaintop. We want to give them the information. Now, here's the problem. Most people that know a lot have a hard time teaching it. They don't know how to simplify it, and they make everything complex. So when I'm giving a lecture, whether it's to doctors or whether it's to patients, that's very plain, simple English. Albert Einstein talked about that. If you can't explain it simply, you don't understand it.
Yeah, he said if you can't explain it to your grandmother, complex theory to your grandmother, you don't understand it yourself.
Yeah. And you know, you're a simplifier. You know, you understand the things that we were talking about earlier, you know, in terms of human behavior, in terms of, you know, Prince and Colby's and things like that, which I do also in our practice. I think it's really important that you understand the people that work for you. Now, by the way, all the stuff I'm talking about, I have a team of over 20 people. They all know this. And so my job becomes very, I wouldn't say easy, but a lot more predictable because there's an algorithm for how we treat patients, and it's smooth, and everybody sort of follows it in my practice. And how do I get people like that? I don't train them. I just hire people that already have those characteristics, and so they're ready to go.
Yeah, hiring the right people.
Yeah.
Well, with the right mindset too, right? You can't train a lot of the skills. If you're not very hospitable person, it's hard to train that.
Can you train somebody to have integrity?
Yeah, that's another episode.
They can train people, just don't steal.
Yeah. In your book, you talk about breaking down barriers. What did you mean by that?
Well, there are a lot of different barriers that we have. All barriers, and we talked about this a lot, you and I, it's all communication. I say that every problem in the world is due to two things. One, a lack of being foresighted, never thinking about the future, wanting immediate gratification, and two, not communicating. So if you look right now in the world, we have a bunch of wars going on that weren't going on, a few months ago. We have more going on now. That's all based upon miscommunication and and fear. So I break down barriers by communicating, and I communicate everything as best I can to my team. We even have forums in the office if there's a problem, breakdown that I got from Strategic Coach, Experience Transformer. If two employees are having a disagreement, they come to me, I go, here, I just hand them each a piece of paper. I go, fill this out. Tell me what happened, what caused it, and what have you learned from it, and then talk to each other. I never see them again. It's figured out because they now communicate.
Mm-hmm.
And we're one of the things that that I pride myself as being extremely honest, not to the point where I hurt anybody, but honest with compassion. So I try to be very honest, and I try to have a lot of compassion for where people are at, unless I'm angry, which I try not to ever get, but I try not to get to that point. But I try to be honest, and I try to treat people with compassion, and I try to have them all communicate with each other. And that's either with me and my patient. My average patient comes in scared to death. It's the scariest thing was to park in my parking lot and walk up the stairs to walk into a periodontal office where they see scalpels and surgeons, and they hear other people have bad experiences and lost teeth. And my average new patient is 65 and has nothing, that's gone to the dentist their whole life and their mouth is a disaster.
Yeah.
And then they come into my office and they don't trust me. They go, this guy can fix you. But nobody believes that anybody can fix you until they get fixed.
Yeah.
I can tell you if you haven't had experience, I'm going to tell you what it's like. You know, it's the first time in an airplane. I say, well, it's not going to be bad. You can go up there, you get scared to death. And then when you land, they go, well, that wasn't so bad. It was just like driving a car up in the air. My patients are the same way. I tell them what it's going to be like, and they don't believe me. And so I have to communicate to them. And there's a lot of ways I can break down those barriers. I can tell them. I can tell them about my own experiences, because I've lost 9 teeth and I have 23 crowns. I've had 2 bad bike accidents where I broke my jaw. And so I've gone through it, and I make it relatable. So whether you had those experiences or not, I think it's important that patients understand that you can relate to where they're at. Now, you don't have to actually relate to them, but you actually have to empathize. Now, empathize doesn't mean that you feel what they're feeling. It means that you're communicating to them that you understand where they're at.
Correct. Yeah, you're not sympathizing, you're empathizing.
Right. Big difference. Like some people, I'm not one of them. You know, they see somebody, you know, in the street, you know, that's not doing well, and they feel so badly for the person. I understand what's going on, but my heart doesn't reach out. It's just the way I'm wired.
Yeah.
You know, when someone has a complication in my practice, then I feel it more, because I have to go take care of it, and I have to become intimate with them. So breaking down barriers is very important, and it really comes from love. You break down barriers by loving your patients, loving the people that you're with, and love doesn't mean, you know, I'm not talking about a physical love. I'm talking about an understanding and a respect for other human beings, so that they can feel that they are being heard and that you're going to take care of them. And that really comes down to trust. And the big problem is fear. Fear. So how do you eliminate someone's fear? You don't say, trust me. You educate.
Yeah.
Okay. You know, the example I always say is, I'm walking down, I spend a lot of time in Manhattan. So I'm walking down the street late at night, and I'm looking ahead, and I hear footsteps behind me. I'm scared. Someone's going to mug me. I'm all by myself in a bad neighborhood. I'm scared to death. So what do I do? Oh, I hope it's not somebody. I hope it's not somebody. No, I turn around and I find out it was a cat. So the fear goes away, because I have the information. Or if it is somebody that is actually, you know, looks sort of, you know, dangerous, I cross the street. And then if they cross the street, then maybe I find an alley or someplace to duck into. So I will take action in that area. But most people get stuck in fear, and that's a whole other conversation. But I realized that my patients I tell them, I said, you know, the joke that I always use is, I'm like a divorce lawyer. I get to see you at your worst, where you're going to have to go through something you don't know what to go through. You don't want to know what it's going to be like. You're worried about the expense, and you feel very, very vulnerable. I said, my goal is to get you through this experience as easy as possible.
I think I stepped on you when you said, you know, the worst thing to say to a patient or a client is trust me. I think I stepped on top of your next part. So I just want to make sure that the listeners hear the follow up. Don't say trust me.
Yeah, don't say trust me. Let me educate you and show you what I'm going to be doing.
Excellent.
It's not trust. Yeah.
So
I mean,
we
have I'm sorry. Let me just make one more point, because it's important. We have an expression in medicine. I don't trust anybody.
Yeah.
Okay. We trust but verify. You know, if someone hands me an anesthetic, they just say, this is what I'm handing you. I look at it to make sure it's the right anesthetic, because what if that patient's allergic?
Mm-hmm.
So and that happens. And by the way, in our own practice, don't trust me either. My staff has permission. I don't only have permission, they are required to tell me if I'm doing something wrong. You know, if I'm taking out the wrong tooth, they'll say, hey, doc, it's the wrong tooth, you know, immediately. Are you sure it's that tooth? And it happens, you know, it doesn't happen all the time, but it does happen occasionally.
Well, yeah. Like even in my engineering office, just because I say this is what it should be, I need people to verify the codes and regulations that make sense, unless there's a change or I got misunderstood. And there's nothing wrong with that. And that's what we got to promote that you're not always right. So these are a lot of great points to consider here, Mike. We're running out of time here. We can be here for another hour, but when we talked about your book in that session, what I really got out of it, and I think you also realized later, this is not just about patients, medical patients here. This is a really good entrepreneurial book. Sorry, not good, a great entrepreneurial book on how to deal with relationships. So a lot of the lessons from your book is very easily applied to entrepreneurial companies and entrepreneurs and their clients. So having that said, Mike, if you were to sum up the core message of treating people, not patients, in one sentence, what would it be?
I think be the most important thing is to be able to relate to where your patients, or your customers, or the people that you're working with are at. And to be able to be empathetic and to understand them and to be open and honest and authentic. Because really, it's not about what we're doing. It's not about, selling. It's not about doing surgery. It's not about building buildings. It's about creating authentic, compassionate human relationships. And it's really simple, but it's very fun. The simple message. And as like I said earlier, you just got to be really nice to people.
Right. Yeah, it is that simple. A lot of people think it isn't, but along those lines, like you said earlier, give people control of the decisions, not having you control the decisions, because you're actually educating the client, which is the best sales tactic. And I really like what you said earlier is, I trust you by how you make me feel. Like, I think the listeners have to take that line and think about it. Do your customers trust you by how you make them feel? How are they reacting to you? If you're that pontificating ivory tower person, how are they treating you? Is it because you're on your high horse, or are you at the same level, eye level, talking to them as regular people, not someone who knows more?
And you got to follow through and walk the talk. Can't just do that on the first visit. Because a lot of people I see don't have major problems, but they're major problems to them.
Right.
And so I have to make everybody feel heard. Like those 9 patients I saw at the end of the day yesterday, 8 of them had they were fine, but they all wanted to talk and check this, and they wanted to be assured that everything was okay.
Yeah.
And I think you said something important. It's how you make people feel. And
well, you said that, not me.
Yeah. Well, we both say it. I don't like to be around people that don't make me feel good.
Yeah.
And sometimes you can't help it. You got family members, right? Not all family members, have the same philosophy. And but I do try to talk to them about that. I said, this is how I feel when you're this way. I'm sure you didn't.
Setting boundaries.
Yeah, setting boundaries, and also telling, and also understanding, and having them understand. Say things like, I know you really didn't make me want to feel. I know you didn't want to make me feel this way, but this is how I felt when you said this. And so you have a nice conversation, not like an angry conversation. And that's what causes all conflicts. People not listening to each other.
Right. So at the same time, too, you're also doing consulting services to the medical professionals as well, right? Along the lines of your book.
Yeah.
Where can we find more information about that?
Well, you can go to my website, which is my name, michaelsonick.com, and you can get copies of my book there.
Okay.
You can sign up for a weekly blog that I do. I also have an online series of video courses. I have a 3.5-hour session that you bring to your team with the workbook. I'm also available for consulting and lectures and that type of thing as well. Yeah,
so we'll have those in the show notes as well, so it's easy for the listeners to find. And I would also recommend, if you help entrepreneurs as well, not just the medical field, like what you have in here is a really well-written book. And the entrepreneurs that do care about relationships and the people first are going to really resonate with this. And I'm really happy you came out with this book. It's very well written. It makes sense. And thanks, Michael, for sharing your experience here in your book. A lot of great insights here for everyone.
Thank you, Andre. Appreciate being here.
And to the listener, thanks for learning with me, and we'll talk to you soon.